Hello and welcome. If you're watching this video, that means that your agency made a great choice and picked HHN Home Health Notify for your HIPAA compliant communication platform. My name is Megan. I'm the Director of Business Development here at HHN. I will be walking you through the app in this video, showing you all the different functions and features. We are so excited to have you. Welcome to HHN. Alright, before I jump in and start showing you the app and all its features, I think it's important that I tell you the why. Why Home Health Notify, why your agency chose HHN. So, to back it up and explain, Home Health Notify was designed and created by a home health agency owner who is also a physical therapist and has experience out in the field. So, to say that this app was created with the complete understanding of what it's like to be out in the field as a busy clinician, what it's like to work in the home health agency office, it's an understatement. It was designed with the complete understanding of all of that and how that is. So I think you'll find that a lot of the functions and features are a perfect solution for what you face on a day-to-day. So with that said, I want to touch on four benefits you'll see from using HHN, four things that are kind of guaranteed when using it. Number one, streamlined communication. This one's kind of obvious. We're a communication platform and we make communication as efficient and effective as possible. Number two, it's HIPAA compliant. So anything you send in the app, anything that happens in the app stays in the app. It's all protected, it's all HIPAA compliant. Number three, improvement in quality of care. You'll notice that just through better communication, everyone on the care team being on the same page and being up to date with the patients in real time, you'll provide better patient care, and from that you'll see better patient outcomes, better patient satisfaction. Number four, easy access to patient info. I know being out in the field, it's not always easy to get access to your EMR, whether it be off your tablet, laptop, phone. I think you'll see that you're able to pull whatever patient info, patient details you need right off the app with ease. With all that said, I think it's time I just jump in and start showing you the app. So right now you are seeing the home screen to my phone. Down at the bottom there it is, your new favorite app, HHN. Going to click on it, and since it's HIPAA compliant, right away it's going to prompt you to either do Face ID, Touch ID, passcode, depends what kind of phone you have. I will do the Face ID. Boom, gets you right in. This is the landing page. So from here, I'll give you just a brief little tour. Down at the bottom, you'll see four tabs. Those are the main navigation tabs. So first is Messages, which is what we open up to. Then there's Directory, Alerts, and Settings. I'm going to walk through each of these tabs individually, but for now we are going to start in Messages. So while you're on the Messages page, if you look up towards the top, you'll see 5 tabs. First is a house symbol. This is for the patient groups. Next is internal groups, which is just internal group messaging within your agency. Next is direct messages, private one-to-one chats, broadcasts, and hidden groups. We are going to start and take a deeper dive into patient groups. Alright, here we are in the patient group tab. Now, as I showed you earlier, this is also the landing page of the app. So anytime you log into HHN, this is where you'll start. Now I know you're probably looking at this, you're seeing a lot of colors, a lot of symbols, probably going, what does this all mean? What's going on in here? No worries, I'm going to walk you through it all. But to start, you should probably have a good understanding of what patient groups are. Patient groups is where you'll go to have any and all patient-related communication. So any messages, conversations revolving around the care for a patient, it'll all take place here in patient groups. Just from a quick glance at this page, you'll be able to grab some pretty valuable information. So let me walk you through it. Let's pretend that I'm a nurse. So right now I am looking at my patient groups tab, And right here, I will be able to see all of the patients that I'm assigned to listed. So right now, if you're looking at my phone, you're seeing names like Mary Matthew, Jamie Walters. Those are the names of some patients. To the left of the patient name, you will notice a house or some kind of symbol. This indicates the status of your patient. So if you look next to Mary Matthew, you'll see a greenhouse. A greenhouse indicates that the patient is active. The start of care has been complete and they're currently active with your services. If you look at Jamie Walters, she has a red house next to her name. A red house will tell you a pending SOC, meaning your agency got the referral, but the start of care hasn't been done yet. If you look next to Tina, you'll see a yellow house. A yellow house indicates discharged, meaning the patient's been discharged from your agency. Next to Emma Thomas, there's a blue symbol that's a hospital. That will tell you that the patient's currently hospitalized. Next to Jessica Tucker is a purple house with a slash through it. That means that the patient is a non-admit. Next to Beverly Rice is our last symbol, which is a half blue and a half red house. That will tell you it's a pending ROC, meaning the patient was hospitalized and is now waiting for the resumption of care. So not only are you able to see the status of your patients on this page, but you can also find out the status of the disciplines. If you look under each patient's name, you will see the disciplines that are assigned to them. The disciplines that are listed there follow the same color coding as the houses. So if you see that the discipline is green, that tells you they've done their evaluation and they're actively seeing the patient. If a discipline is red, that tells you they haven't done their evaluation and they aren't seeing the patient yet. If a discipline shows up as yellow, that tells you they've discharged that patient from their services. Now let's practice with a few examples. Looking at my phone screen, you'll see my first patient listed there is Donald Davis. This is an easy one. He's a red house, meaning pending start of care. And if you look underneath his name, there's just the nurse listed there, and that is red. So that tells me he's a new patient and we haven't done the start of care yet. Now, if you look down at the second patient, Vincent Von Viller, he's a greenhouse and he has 4 disciplines listed there. He has nurse, PT, OT, and home health aide. Now, SN, PT, and HHA are all green, telling me that they're active, but the OT is red. So that's telling me that the OT is the only one who hasn't seen the patient yet. It also tells me the OT might be slacking. I'm just kidding. And then one more example, Miss Sylvia Smith. She's the next one down. She's a greenhouse, telling me we're actively seeing her. The nurse is green, the PT's green, and the OT's yellow. So that tells me that the nurse and PT are still actively visiting her, and that the OT has already discharged her from their services. So not only can you get a good idea of what's going on with all your patients just from scrolling and seeing all the different houses, but you can get a little more specific, and if you click the filter icon up in the right corner, it'll pop up with all the different statuses, disciplines, colors, and you can play around with it. So let's say I want to see all of my hospitalized patients. I'll click hospitalized and apply. It'll show me all of those patients. You can get even a little bit more specific. Let's say I'm the PT. I want to see all of my patients that are active, so start of care has been done, but I haven't gone and seen them. So I'm going to click active for the greenhouse, PT, and pending. So PT has not done the eval yet. Apply. And as you can see, I have some work to do, but it's a good way to narrow down your patients and see what's going on with everyone. So looking underneath each patient's name, we talked about the disciplines that are listed there. Underneath the disciplines, you'll see you get 3 little tidbits of even more info for your patients. So right there, it's the patient tag first, which it's really up to your team how you want to utilize the tags, whether it be for the patient's primary diagnosis, fall risk, wound care patients, however your team wants to use it, totally up to you. Then the patient's physician is listed along with the patient's information. Now for more patient information, if you swipe right to left, it'll pull up the patient info page. So here it starts with patient name, physician, then patient's date of birth, because anytime you call the doctor's office, right away they're going to say, what's the date of birth? It's right there for you, along with the patient's phone number, which if you click on the phone icon next to it, you can call right from the app. Has the patient's address, which my field staff people, if you click on the address, it will take you right to Maps. You are on your way. Beautiful. I love that feature. Underneath the address, it shows you the dates of the episode, patient's insurance underneath that. Gives you all the referral info. You can actually pull up the referral, check it out before you go into the patient's house. Then there's the About section, which I think this is a really great part for everyone to be on the same page. So as you can see in this About section, it says call/text the patient's son, John, to schedule the appointments and enter through the garage. Here's the garage code. So it's those little things that might take up 5 phone calls for everyone to know about. It's all right there. Everyone checks it before they go see the patient. They know what's going on. And then underneath that is the physician's phone number, name, caregiver's phone number, name, which you can also call straight from the app as well. So also from the patient info page, if you look up at the top, you'll see there's 4 tabs there. We're on info, then there's members. So members will show you who is all on the care team with you for this patient. So it'll show you the aide, the nurse, PT, the other disciplines, along with the office staff who is on the group for each patient. Also from the patient info page, if you look in the upper right corner, you'll see a little calendar icon. If you click on that, it will pull up the patient's calendar, showing you when their doctor visits are, when the PT's visiting, the other disciplines are visiting, and it gives you a good idea of what days are best for you to visit and what times. And also in the upper right corner, you'll see a completed and projected tab. You can switch to completed visits to see what's been done, and then projected to see what's scheduled and what's to come. Now, you'll also notice there's some colors on the calendar. The first 30 days are blue, and the second 30 days are an orange color. Now, the blue will turn to green once the LUPA threshold's been met. You can track the LUPA by clicking on, you'll see it says LUPA up above, and this is going to show you where you are in terms of the LUPA. So as you can see, for the first 30 days, we are meeting 2 out of 6 visits. And once you hit 6 visits in the first 30 days, it will turn green, letting you know you're good. And same with the orange color. Before visiting a patient for the first time, there are 3 things you should always do. First is check out the patient's referral, see why you're seeing them and what's going on with them. Second, always read the About section. There's probably some good info there that you'll need to know before stepping into the patient's home. And third, always check out the patient's calendar. You'll need to see what days and times will be available for you to schedule, and also just gives you a good idea of what that patient's day or week will look like. If you follow these 3 steps every time, you'll have the smoothest interaction with patients, and they'll also be able to see the coordination within your team and feel confident in the care that they're receiving. Let's jump into one of the chats and learn all about messaging. So when you click on a patient's name, it'll pull up the group chat associated with that patient. Now in here you can do the standard, send a text like you would expect. You can send a picture, send a video, scan a document, all while remaining HIPAA compliant. Now we have some advanced features that you'll be able to use with your messaging, and I'm about to walk through those right now. The first messaging feature I'm going to go over is a priority message. Now, priority messages are for when there's something urgent going on with your patient that the rest of the group needs to know about. So, for example, let's say you're at your patient's house and their blood pressure spikes to 180/100. What you'll do is you'll go in the patient group chat and you'll hit the hazard triangle there. It'll pop up telling you priority message on, and then I'm going to type, oops. Now when I send this, it's not only going to pop up with a red banner and flag as a priority message, but it will also show up in everyone's alerts in the priority section, which I'll show in a little bit. So I'm going to send this, and boom. Now it's important that everyone remembers priority messages are for when there's urgent matters regarding a patient. Now it's not supposed to be used for you asking someone in the office to maybe schedule your visits in the EMR. Those things might feel priority to you, but there's actually a different feature that will help you with that, and I'll show it next. Which brings us to the Ask for Acknowledgement feature. Ask for Acknowledgement messages are for when you're directing a message to a specific person and they have to give you confirmation that they've received the information, your message, and they're going to take care of it. So let's try it out. Like the example I just said, asking someone in the office to schedule your visits in the EMR. So I have it typed up. Could you please schedule my visits in the EMR? Thank you. And if I send this, no one really knows who it's directed to. I didn't ask for acknowledgement for anyone. So what you'll do is you'll do a long hold on that message, and the second option you'll see is ask for acknowledgement. So I'm going to click that, and then I'm going to add the scheduler, who will do that for me, Susan, and send. So now everyone in the group will see that I sent Susan and asked for acknowledgement because it's obviously a message directed to her. Now, when Susan sees this, it'll show up in her alerts section under Ask for Acknowledgements, and she'll have to tap it to give me a thumbs up. Once she sees it and taps it, it will turn green on our end. So let's see how on top of it Susan is. And there she is. It turned green, letting me know Susan saw it and she's going to take care of it. Physicians can also be on patient groups, but they'll only see the messages you specifically allow them to see. Because obviously, majority of the messages, which there will be a lot of messages, will be more relevant for the agency staff. We don't really need the doctor to be seeing all of those. So there's a special way to send them a message. For example, I have it typed up here that the patient's having increased lower extremity edema, they're on 20 milligrams of Lasix, please advise. So I'll send that, and obviously that's not really for anyone that's on the agency staff side, it's for the physician. So the physician won't be able to see it until I make it visible to them. How do I do that? You send the message and then you're going to long hold down on your message. And pops up the menu. The fourth option down says visible to physician. I'm going to click it, and the message will turn blue, telling everyone in the group this was for the physician to see, and when the physician replies, the message will also be blue. Patients and their caregivers can also be on the patient groups, and the messaging for them works the exact same way as the physicians. They'll only be able to see the messages you specifically want them to see. Because obviously, majority of the messages will only be relevant to the agency staff. So let's try it out. Say you want to let the patient know that you're running behind and you'll be there 30 minutes later than expected. So I'll type send. Now the patient's not going to see this message until I make it visible to them. So I'm going to long hold down on that message, and you will see down in the middle it says visible to patient. Click on it, and that message turns purple, letting everyone in the group know I made that visible to the patient, and when the patient replies, the message will also be purple. Another great feature in the messages is star messages. Now, star messages are like your own personal to-do list. Say there's a message for you that you can't take care of right now, but you need to remember it later or be able to reference it quickly later. So, for example, on my screen right now, you'll see, please call the patient's daughter in the morning. So I can't do it right now because it's too late. So I'm going to long hold on that message I received, and it will pop up the second option as star message. I'm going to star it. And now when I start my day tomorrow and I check my priority, ask for acknowledgments, and my star messages, it will be there and I'll remember to call. You can also set reminders up in the patient groups. For example, let's say your patient needs a catheter change in 10 days. You obviously want to be reminded of that. So you're going to click on the clock icon above your keyboard there. Type in the details and the day and time that you want to be reminded. April 8th, 4 o'clock. When you're all done, you click the check mark and it will pop up in the group that you set a reminder. And now 10 days from now, April 8th at 4 o'clock, it will pop up in this group again as an ask for acknowledgement to remind me to change the catheter. While using the app, you'll probably find that you are typing and sending the same message over and over again. So to make things a little bit easier, we have the feature of quick replies, where you can have those messages pre-typed and ready to send whenever you need them. So if you look above the keyboard, the second icon from the right, it's a little message box with a lightning bolt. That's where you'll find your quick replies. So you click on it, and here's my list of the ones that I have pre-typed, and I'll just click whatever one, and it'll send into the patient group. Now I know you might be wondering, how does this app stay up to date? Who's changing the colors of the houses and disciplines? How does this all happen? Well, all the changes in the app happen from templates. Templates are what we call the lifeline of the app. They're brief notes that clinicians fill out after any time they interact with their patients. I know right now, clinicians, you're saying, no. I knew this app was too good to be true. I have to do documentation now. Nope. I promise you, we kept templates down to the absolute bare minimum for that exact reason. And none of these templates actually take more than a minute. I would say even the start of care takes 30 seconds. And it's actually things that you're already communicating to your team somehow, but it's a more efficient way. I'll stop talking and I'll show you. All right, let's walk through some templates. So if you're looking at my phone screen, you'll see that I am in the patient group right now for Donald Davis. He has a red house, meaning pending start of care. And you'll also notice the last message that I just acknowledged was, please call the patient to confirm SOC date. So we'll act like I called and I know a date. So now I'm going to let them know when the SOC will be, which there is a template for. So if you look right above the keyboard, there's 6 symbols there. The second symbol is a little document with a squiggly line. That's where you'll find all the templates. So click on that. And you'll see, obviously, since Donald is a new patient, it comes up with these 3 options: SOC, schedule SOC, or missed visit. So I'm going to schedule the SOC, and this is all I have to fill out for that. So visit date, we'll say tomorrow. Visit start time, I'm going to say 11 a.m. And it will automatically give you a 2-hour interval for the end time. And notes, I'll just say done and submit. Now you'll see that populates into the patient group, letting everyone in the office know, hey, I scheduled the SOC. And so now they'll be able to see the date that the SOC is going to be. So when they see the red house, they won't be like, hey, You got to take care of that. They'll see that it's scheduled, I took care of it, and I'm going to see them tomorrow. Now that you've scheduled the SOC, let's walk through the template for the start of care once it's complete. So I'll click on that symbol again for templates. The first option, start of care. And this is the template for start of care. I swear, it's nice and easy. SOC date, it was today. We'll say my time in was 1 o'clock. Time out, we'll say 2:20. The contact person at the doctor's office, I'll say Melissa. Next doctor visit, patient told me was the 7th. I'll be back on the 5th at around 1:30. And now I just have to pick which disciplines are needed. So nurse, and I'll have to type in my frequency. PT, OT, and we'll say home health aide, which when you choose home health aide, you'll also have to put their frequency as well. And submit. Now, not only does that start of care template populate into the patient group, but now if you look up at Donald Davis's name, you'll notice it's a greenhouse and that the disciplines are listed now underneath his name, showing the nurse is green because I just did the start of care, and the rest of the disciplines are red because they just got assigned, they haven't seen the patient yet. It's that easy. Alright, so now I'm logged in as Donald Davis's physical therapist. The start of care was just completed, so now I have to go and do my eval. So I'll click on the template symbol again, and you'll see I have 4 options here. Schedule eval, transfer, schedule or cancel a visit. Because obviously, first thing I need to get done is my eval. So I'll show you schedule eval works the exact same way as scheduling the start of care. You choose the day and time, submit. Now, let's go to the eval template. Let's say I'm really on top of it. My team's been using HHN for a while now. We're super efficient. I'm already doing my eval 5 minutes after the start of care. So I'll say visit date, today. I spoke to Melissa. My frequency will be 2 times. Next doctor's visit is the 7th. I'll be back on the 6th at 2 o'clock, I'll say. And submit. So now you'll notice my eval template is in the group, and also if you look under Donald Davis's name up above, you'll see that the discipline letters for PT are now green. So I am active with the patient, all because of the templates. I swear, it's easy. So going forward, like I said, there is a template for anything and everything in terms of visits or interactions with patients. So if I click on the templates now, these are the options that pop up. Revisit, missed visit, transfer, discharge oasis, vitals, anything at all, there's a template for it. Make sure to fill out the templates and everything will remain in real time. Everyone will be on the same page, up to date with the patient, and you'll see improvement in your patient care. Now that we've covered messages, let's take a look at one of the other main navigation screens. So if you look down at the bottom of my phone right now, you'll see we have directory, alerts, and settings. Let's take a look at directory. When you click on directory, this is what pops up. It's all the people who are on HHN, all the contacts for them. Up at the top, you'll notice there's 3 tabs. These are separate categories of contacts you could have in the app. So the first one is everyone in your agency. All the field staff, office staff, everyone will be listed here. The second tab will take you to all the physicians in the app. And the third one will be all of the patients and caregivers in the app as well. So when you click on anyone's name in here, it will automatically take you to a one-to-one direct message chat with them. If you click on their name, it will take you to their profile, give you some information on them, and you can also do a video call or phone call from here as well. The great thing about the directory is that all of your contacts are stored in here. You won't need to worry about adding them to your phone or anything like that. They'll all be in the app. Now let's move on to the next main navigation screen, Alerts. Alerts is where you will find your most urgent notifications. Here is where you'll see 4 types of messages: your priority messages, ask for acknowledgement messages, pending referrals, and star messages. So Alerts is a good place to start when you're hopping on the app to see what is needing your attention, what's urgent. Because obviously in all of your patient groups, there's going to be tons of messages, and not all of them will necessarily be directed towards you. So to go to your alerts is to see all the things that are asking for you, asking for some sort of action from you. So if you're looking at the screen, right away your alerts takes you to your priority messages. So as you can see here, I have 2 priority messages, and they won't go away in the alert section until you click on them and view them. So when I click on this message, it will take me to the patient group, show me when the message was sent and everything, and the conversation revolving around it. And then you can go back, takes you right back to your alerts. And then if you click on the second tab, you'll see all of your ask for acknowledgements. So any message that someone asked for you to acknowledge. So from here, you can either tap it and acknowledge it from here, or you can click on the message and it'll take you to the patient group. So let me show you. The second one, I'm going to just tap. And the first one, I will click on it and it will take me right to the group. I can read what's going on, tap to acknowledge it, and now you can see all my ask for acknowledgements are gone. In the upper right corner, you'll see that there's a pending and a sent button. You can also check out the sent acknowledgements that you've made, waiting for someone to acknowledge a message you sent to them. Now the next one is where all your pending referrals will be. So when the office has a new referral and they want you to accept the patient, this is where you'll find them. So you can either choose to accept or refuse a patient, and when you accept it, you'll automatically be added into that patient group, and you'll see a new patient on your patient groups tab. And if you refuse, you'll have to type a reason why, send it, and the office will get notified saying you refused it. We'll need to find a new field staff for it. So the first one, I will accept it. And now I will see Jamie Walters as a new patient in my patient groups. It's just loading. And then the fourth message are my star messages. So here will be all the messages that I have chosen to star because maybe they're things I couldn't handle in the moment and had to save for later on or the next day. Any type of message that I kind of want to put on my personal to-do list, or I always say they're kind of like sticky notes. They will be saved right here in your alert section. And once you've taken care of it, make sure to unstar it so that it won't be listed here anymore. So a good thing to get in the habit of is every day when you hop on the app, log in, go to your alerts first and check out your priority messages, ask for acknowledgements, your pending referrals, and your star messages. Make sure your alerts are always at 0, because that means that you're staying on top of everything and getting the job done. Last but not least, we have settings. So settings is where you'll go to do a lot of personal preference type things in the app. But for field staff, one of the main features here is the calendar. So in the upper right corner, you'll see a little calendar icon. I'm going to click on that, and it will pop up and show you all your patient visits that you have scheduled. You can switch between completed and projected visits. Now, the best part here is when you click on one of the days, so let's say March 30th, it will show you your plan for that day, the times, who you're seeing, all that good stuff. In the upper right corner, if you look, you'll see a little map icon. If you click on that, you will see the app will take you to the route for that day. It shows you the order that you have planned. You can see the little numbers next to the houses showing you what number visit that is for you that day. And if you find yourself looking at this and you're kind of like, well, I could have definitely scheduled that better if I had known, I'm driving back and forth, passing this house when I'm going to this house. If you look in the lower left corner, you'll see that you can switch it to suggested view. And when you click on that, the map automatically rearranges the houses in the best possible, most efficient route for you that day. Now, if you click on it, it'll show you the times that would be better to see the patients based off of the map optimization. And you can also click navigate and start your route. You'll go to Google Maps, starting your route for that day. It's just a great feature to really save time where you can and make the most out of your days out in the field. Another important feature here on the settings screen is organization media. So if you scroll down, the third one there is organization media. This is where your agency can post any documents, PDFs, videos, anything they want you to have access to. For example, maybe a COVID protocol sheet. You can find it all in here in organization media. I walked you through the app. I showed you all the main features you'll need to know in order to use it on a daily basis. And I know it probably feels like a lot. We covered a ton. So in order for you and your agency to be pros at HHN and be successful with it, get the most out of it, I have some key things for you guys to follow and make sure you do in order to take full advantage of this new tool, HHN. So if you remember anything at all from this video, let it be these next couple things. So we've narrowed it down to 4 things. If you follow these 4 things, you will see improvement in your patient care, and overall as an agency, you'll see good things. So number 1, communicate in real time. As soon as you find something out about a patient or situation, communicate it to the team and the people that need to know. Do not wait until after your visit or once you're back in your car, once you're back home. Take care of it right then and there and communicate it. Communicate in real time. Number 2, red is dangerous. So thinking back to the features on the app, anything that was highlighted in red was really a patient at risk. A red house, pending start of care, meaning a patient was discharged from the hospital, is now back at home, waiting for home health services to see them. They're in a vulnerable state. They just got out of the hospital. They're at risk to go back if they're not seen by home health sooner rather than later. A red priority message, meaning there's something urgent, something critical going on with the patient that needs action. Any alert, it pops up as red. Reduce the red. Take care of your patients. Make sure they're safe. Red is dangerous. Number 3, templates are the lifeline of the app. Anytime you interact with your patient, template, template, template. In order for the app to remain up to date and as real time as can be, templates are a huge thing that need to be done. Templates are the lifeline of the app. And number 4, ask for acknowledgement. This is a feature I don't think you can possibly overuse or abuse. If you think about it, asking for acknowledgement is making your message, your communication direct. The more direct communication is, the more effective it is. So make things efficient for your team and ask for acknowledgement. Don't leave them wondering who should take care of it or who the message was for. Tag someone, ask for acknowledgement on your message, and get things taken care of right then and there. If you follow these 4 things, I promise you will be successful with HHN and successful as an agency altogether. Last but not least, I want to say thank you. Thank you for not only sitting through this video and taking the time to learn about HHN, but thank you for embracing Home Health Notify as the new way for you and your agency to communicate. I know change can be difficult and adding a new tool can feel daunting at times, but I assure you, you're going to love it and love the changes that it makes with you and your team. Thank you.